body, and you can see that independent of how this happens, your immune system builds a reaction to it, and you get these blood clotting and inflammation occurring in people, particularly with these other health problems, who are not being treated. When I entered medical school, we had pulmonary patients come in who couldn't breathe with pneumonia, or bronchitis, or COPD, or reactive airway disease, asthma. We put them on IV steroids and antibiotics immediately. This isn't happening for COVID-19 patients because the doctors are being told there aren't treatments. If you treat, you'll lose your license. There'll be repercussions. You'll lose hospital privileges. You don't think so? Look in the news at Houston right now. Okay? Look all over the world. This is happening. This is how it happens. You have to treat that. And here's the cell. This is an enlarged version. This is on FlemingMethod.com. There's a page that walks through it. This is a cell. This is how viruses get in naturally. If you look here, you'll see all 4 of those receptors I talked about earlier. But here's the virus getting in. You treat a virus by reducing its ability to get inside cells, by reducing its ability to reproduce itself, and by reducing the inflammation and blood clotting, which occurs at 2 times. Initially at 3 to 4 days, when it comes in, gets reproduced, and it starts to get broken down, and it gets presented to the surface of the cell on what's called major histocompatibility complex 1, top shelf. Okay? That takes 3 to 5 days, and the T cells there respond. What do the T cells do? They try to kill it. That's their job. They release chemicals that kill tissue and kill cells that are infected. And what does that do? It causes inflammation. And it can cause blood clotting. So you treat that. And at 10 days, 7 to 10 days, what got out will eventually come back in and get presented under major histocompatibility complex 2 to what's called the beta cells or B cells that make antibodies. And that's why it takes that long for antibodies. And the antibodies and the chemicals produced do the same thing. They attack. They try to destroy. And they produce inflammation and blood clotting. Because if you can blood clot off an invader, it will die. It doesn't get supplies. It doesn't get nutrition. It doesn't get oxygen. These things, these inflammatory thrombotic responses that I presented in the theory, are why the people with COVID-19 have been dying. These deaths are all the result of the federal government telling people there's no treatment and not allowing doctors to practice medicine and controlling the way in which that practice of medicine is being conducted.